Congress passed a law last year that is supposed to provide relief for seniors struggling to cover the cost of their drugs. A Largo couple tells our Taking Action reporter Jackie Calloway they qualified for the money, but they could not get their hands on that check.
That is exactly what happened. The Affordable Health Care Act provides a one-time rebate to help anyone on Medicare. Charles Greenberg qualified for that $250, so I wanted to know what was holding up his money.
High blood pressure medication, cholesterol medication.
Charles Greenberg and his ailing wife depend on prescription medications.
We got these at Walmart.
Yeah.
And it was over $400.
The Greenbergs, like millions of retirees, rely on Medicare to pay for most of their drugs, but then they fell into the dreaded donut hole. Okay, here's why they call it a donut hole. Medicare pays for the first $2,500 of your medicine costs, but then patients fall into that hole, and that means they're paying 100% of their drug costs until they hit the $4,500 mark.
It means they have hit the initial coverage limit in their Part D plan.
Robin Watt with the West Central Florida Area on Aging says the donut hole prompted Congress to pass a one-time rebate of $250.
It was anybody who fell into the donut hole.
She ended up in the donut hole September 1st.
Charles Greenberg says he called Medicare for 3 months, but was still waiting on a check when he contacted me in January.
I was angry and I was aggravated. I was angry that they treat you like I said, like you're a number.
I reached out to Greenberg's Medicare provider, who got in touch with Medicare. Days later, the Greenbergs received a call from their insurer.
He told me it was being taken care of and I should get my check.
Robin Watt says what happened to this couple is not uncommon, considering the crush of claims pouring in.
And we've looked into that and found out that most of the time the problem is a backlog between the insurance company getting the information to Medicare and Medicare being able to get the check back out.
So, the way the system is set up, anyone who falls into that donut hole should not have to do a thing. The insurance provider is supposed to contact Medicare within 45 days, and then Medicare is supposed to process that rebate. Now, if you're one of those waiting on a rebate, you can call 1-800-MEDICARE to check the status of your money.